Hi, I'm Morse, the founder of Elements Training, and this is Katie Campbell, one of the tutors on our manual therapy course. In this short video, we're going to demonstrate mobilisation techniques for the lumbar spine. I'm going to demonstrate PAUVPs, PACVPs, transverse pressures, and rotation to the lumbar spine. PAUVP stands for passive accessory unilateral vertebral pressure, and PACVP stands for passive accessory central vertebral pressure. For clients that have more of a lordotic back, it's helpful to apply or place a pillow or bolster or rolled up towel underneath the abdomen. If you could open up, put that underneath, lay back down. This will help to open up the lumbar curve and it allows better palpation and pressure to be applied to the spinous process and the transverse process. We're going to palpate the spinous process for the PACVPs, the passive accessory central vertebral pressure, and we're going to apply the force moving towards the feet. If you've watched our other video in the cervical spine, we applied the pressure towards the eyes. That allows for the natural curve in the cervical spine, and applying the pressure towards the feet allows for the natural curve in the lumbar spine. So find the spinous process. And they should be quite easy to find, a lot easier to find if you've got a towel or pillow underneath. In this position for the lumbar spine mobilisations, we're going to make sure our pelvis is parallel to the couch. Make sure you've got a good position, so a nice wide base, pads of your thumb on top of the spinous process, and it's very important as well to continue to the assessment movement. So just push the pressure, place pressure on the spinous process, come back up, then ask your client how that felt. Is that okay? So we're looking for pain and we're feeling for stiffness. So if it's painful, you know you've gone too deep, so just ease off another assessment movement to find out the right depth for your mobilisation, and then you'd pick your grade. If you're trying to reduce pain, we're going to go for grade 1 or grade 2. Grade 1 being a small oscillation, grade 2 being a larger oscillation. If you want to increase range of movement, either rotation, flexion, extension, side flexion, you would choose either grade 3 or grade 4. Grade 3 will be a large or a longer oscillation, and grade 4 will be a smaller oscillation. So we're going to go for grade 3 here. So here we're just going to touch the end of range, feel for the end of range, and then come back off. It's a large oscillation, even though you probably can't see too much when you watch someone to perform this, in comparison to, say, the shoulder or the knee, where there's a much larger range of movement available at that joint. So grade 3, large oscillation, just feeling for the end of range and coming back off. Grade 4, stay in that end of range. So find the end of range there and stay within it. And again, 3 times 6 is a good place to start. And like we've said in other videos, you can move through the ranges. So if you start off of grade 1, because it was very, very acute, very, very sore, very painful, quite sensitive, and the pain eased off, then you could move to a grade 2 and do a set of mobilisations in that range, in that grade. So just things to think about: your posture, nice wide base, positioning for your thumbs. If you're very hypermobile and you struggle to keep that nice straight line between your thumb and hand, then you can reinforce your thumb. Just make sure that you're not wobbling around. So it's not a soft tissue we're feeling for the density of the bone. And we want that sustained pressure, so the oscillation should be the same. The depth of the oscillation ideally will be the same. As we move further down to the lumbar, just moving towards the feet. And you could do your set of 30 or 60 here. Some people respond quite quickly. If you feel a change, then by all means come off, assess the range again, and it may be that you can change the grade that you're working with. That was for central vertebral pressures, so the PACVPs. And then for the UVPs, the PAUVPs, you want to find the transverse processes. So about a thumb's width apart. If you look on the skeleton here, you can see the transverse process alongside the spinous process. So it comes straight out of the lumbar, sink through the soft tissue, find the bony prominence, and again you're going to be pressing down towards the feet, creating a glide between the vertebrae. Don't forget your assessment movement, and then by the response of your assessment movement you'll then pick your grade. So that was PAUVPs and PACVPs, the spinous process and the transverse process, either to increase range of movement or to decrease pain levels. For transverse pressures, we want to find the spinous process of the lumbar spine, and we want to press it transversely. Again, this is a lot easier with a pillow or bolster or towel. So the spinous process is here, feel the density of the bone, come back towards you, push through the soft tissue, push the erector spinae just out the way, sink towards the couch, so your thumbs palpate the side here, the side of the spinous process, and then we're just going to press away from us. So again, good position, nice wide base, chest up, because again we might be here for a few minutes. Assessment movement first. How does that feel? Is that okay? Yeah. So good, so I could feel the end of range there. So we'll start with a 3. You can see a slight rock there. So there's no pain, and it does feel a little bit stiff. So we'll start with a grade 3. It feels like it's going to loosen quite quickly. So after we've done 60, we would then stop, assess the movement again, and probably in this instance we would move to a grade 4. That was PAUVPs, PACVPs and transverse pressures of the lumbar spine. I've just shown a couple of vertebrae, but you can perform these through the whole lumbar. For rotation, the physiological movement, we ask our client to pop themselves on their side. So if you could lift your legs up, and I'll grab the pillow. So it's important to set up correctly, otherwise you won't get that nice rotation through the spine. So ideally you want a nice straight spine, nice straight back. A lot of people won't know what that feels like, a lot of your clients, so you may have to instruct or cue them. We want to envision we've got a pole through the pelvic girdle and the shoulder girdle, and then the bottom foot. So the bottom leg needs to be straight. The top leg, knee bent, knee flexed, with the ankle resting just above their knee if they can. So not everybody can be in this position. So if they haven't got the knee flexion or they haven't got the range of movement to tuck the ankle in, you can just relax the leg like this. Use the client's arm and shoulder to rotate the spine so their chest faces the ceiling. So here, just clasp underneath the shoulder, using the arm to support, and just rotate the spine. Pop the hands across their chest, across their hands, across their chest. This allows you an area where you can hold and support. So ideally you want to create that rotation through the spine. And here we're going to focus on the lumbar. So more hip flexion will equal lower stress or lower rotation or a lower stretch to the lumbar spine. So the higher up the knee is, the lower down the mobilisation will be. We're going to push towards the corner of the couch, maybe in line with the femur, using the top of the greater trochanter. You should find an area where the heel of your hand fits quite nicely. We don't want to be right on top of the greater trochanter because there's no grip and we'll just slide over it. So just come back and you should be able to feel the top of the hip there. Using that bony part of the body, apply the pressure and create some rotation in the lumbar spine. This is grade 3. You'll do your assessment movement as normal, and for a grade 3, we're going to just touch on the end of range, feel a little bit of resistance and then come back. So in grade 3s, you get to see a little bit of that bounce. Thinking about your posture, we wouldn't want to be upright like this, bending over. So have a nice wide base, chest up. You're using your other hand to support on their shoulder. You may find that if it's a little bit uncomfortable or very stiff, their thoracic wants to rotate in that way as well. So that's grade 3. If you want to increase the grade to grade 4, where we stay in the end of range, we can ask the client just to straighten their leg. The extra weight here will increase the grade or create the pressure. You'll find it easier to get into the end of range. And again, a small oscillation here. To help rotation of the lumbar spine. You can ask the client to bring their leg up. If it's very sore, they may need some help to bring the leg up. If your client's okay, you can ask them to bring their leg up, then they can unwind themselves. If you'd like to lie on your back. So we covered PAUVPs, PACVPs, transverse pressures and rotation of the lumbar spine. These are all covered in our manual therapy short course. If you'd like to find out more, please visit www.coreelements.uk.com. Don't forget to subscribe. Thank you.